Government at all tiers have been enjoined to build more health centers equipped with modern facilities in every communities of the country and work on training more medical personnel to combat the menace of diabetes in Nigeria. A senior registrar endocrinology, Dr. Gbenga Ikushedu, who stated this while speaking with Nigerian Newstrack on this year's World Diabetes Day with the theme Access to Diabetes Care, said many Nigerians living with the illness are still not diagnosed. Diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose or blood sugar, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys and nerves. What then is diabetes to an average Nigerian, and how regularly do people check their blood sugar?
Diabetes is a kind of disease that occur that derive from eating too much of sugar.
Even the rich ignore it because they don't have the time for it. They don't have the time checking themselves up.
While some do not know what diabetes is, many respondents who spoke to Nigerian Newstrack tend to be more concerned with what they will eat. A senior registrar endocrinology, Dr. Gbenga Ikushedu, says there is the type 1 diabetes, which is lack of insulin, and type 2 diabetes brought about by ineffective use of insulin.
People, mostly for the type 2, it comes in people who live sedentary lifestyles, who are a bit overweight. They may develop a form of insulin resistance, and then thereafter develop diabetes. Also, some people, when they get pregnant, they develop gestational diabetes, which and then some people is inherited genetically.
Dr. Ikushedu said many still do not have access to diabetes care even when they are diagnosed.
Lack of human resources. We do not have enough doctors to cater for the huge population in Nigeria, and we do not have enough specialist doctors. Also, we do not have enough health centers. You know, we should have health centers in every local government in Nigeria. Every local government should have a specialist and a health center, but these facilities are not available. Also, too, even where they are available, many people do not have the funds to access those places because of the cost. A lot of people are living below the poverty line.
Dr. Ikushedu, who confirmed that having diabetes is not a death sentence, said it can be managed effectively, thus the need for government to come up with a sincere health insurance scheme and improve on the welfare and training of health personnel.
The health insurance needs to be strengthened for most people who are below the poverty line in Nigeria to be able to access quality health care. I think that is one major way. Like in the UK, that's what they do. They have the NHS, which does that. So most people don't pay out of pocket when they are ill. You just go to the hospital. Your insurance covers almost all your bills.
He advised on having regular medical checkup, balanced diet, exercise, sound sleep, and quitting bad habits that could pose health challenges.
Because these things is not until when it becomes complicated that we should start treating them. From the very beginning, early diagnosis is very key.
According to the World Health Organization, about 422 million people worldwide have diabetes, particularly in low and middle income countries, while 1.5 million deaths are directly attributed to diabetes each year. Dayo Da Silva, reporting for Nigerian Newstrack.